If you're over 50, chances are you've heard of Viagra. Maybe a mate's mentioned it, or perhaps you've considered it yourself. But before you pop that little blue pill, it's important to know, Viagra isn't for everyone, especially as we get older. Let's talk about who should steer clear, and how to keep things safe if you do decide to take it. So, what is Viagra actually for? Well, it's a tablet taken to treat erectile dysfunction, usually about an hour before sexual activity. It works by relaxing blood vessels, improving blood flow, and making it easier to get and keep an erection. For many, it's a real boost to confidence and relationships. But like all medicines, it comes with its own set of risks, especially if you're in your later years. Now, can older adults take Viagra? In most cases, yes, but with a bit of caution. If you're over 65, it's best to start with a lower 25 mg dose. That's because as we age, our bodies clear the drug more slowly, which means you're more likely to get side effects like flushing, headaches, or even nosebleeds. If the lower dose works for you, brilliant. If not, your GP might suggest a slight increase, always under supervision. But here's where it gets serious. Certain people shouldn't take Viagra at all. Top of the list are those on nitrates, medicines like nitroglycerin for heart conditions. Mixing them with Viagra can cause dangerously low blood pressure, and that's not worth the risk. There's also a medicine called Riosegwat, used for certain lung problems, which is a definite no-go with Viagra for the same reason. Then there are others who need to be careful. If you've had a heart attack in the last 6 months, heart failure, or serious rhythm problems, you should speak to your doctor first. Viagra affects your blood flow, and if your heart's not in good shape, it could put extra strain on it. And don't forget about drug interactions. Some medicines like ritonavir, a treatment for HIV, hepatitis C, or even COVID-19, can increase Viagra levels in your blood, raising the risk of side effects. In these cases, your doctor may suggest a lower dose, or space the pills out more. It's also worth mentioning that rare eye conditions, like retinitis pigmentosa, can make Viagra unsafe. Always tell your GP about your full medical history before starting. So, to wrap up, Viagra can be a helpful option, even for older adults, but it's not one size fits all. If you're thinking about it, have an honest chat with your doctor. Never try it with nitrates, be cautious with other meds, and always start low and go slow. Your health comes first, so look after yourself, and make sure you're making the safest choice for you.